Hello, everyone, and welcome back to Unfiltered Vet Discussions. My name is Kelly, and I am being joined by David and Phil today. You can see more information about us at unfilteredvetdiscussions.com, as well as various social media platforms. Pick one, and we're probably on it, as well as podcast platforms like Spotify and Amazon, Google, and Apple. Please join us there and subscribe so you get our latest releases. Today, we are going to be discussing vet inflation, or just prices that are being charged and what has happened and how are pet owners responding to that, how our practice is responding to that. We have different viewpoints from this room. Personally, I'm a pet owner as well as helping out veterinary hospitals with their marketing to get tails through their door. Phil actually works in practice and David sees financials all day long. So I'm just going to open up the floor and say, gentlemen, we were kind of talking before this about some stories that we're hearing and considerations that we're having and just changes that are happening in the marketplace due to costs. Any thoughts?
Yeah. I well, like we said in the interim, and we're preaching to the choir.
Right?
Vet med's expensive. Pet care's expensive. It's not subsidized by uh, the insurance, human insurance, which distorts perception of value and expense because you can go see a specialist and you just have a $20 copay, and
Right.
everything else is behind the screen, behind the
Yeah,
curtain, the all-powerful Oz, just manipulating
right.
things and all the problems that causes. Whereas vet med, it's much more transparent. We have direct
Yeah,
costs of providing pet care and the increasing expense of providing that care, regardless of whether you're high volume, low cost, or high touch, client education, that spectrum of care, it's expensive.
yeah,
And I work with a lot of clients that struggle at adjusting fees accordingly. And yes, every time you give your employees a raise, there should be an immediate and corresponding service fee increase. We've talked
yeah,
about that, but it's
yeah,
easier said than done.
Yep.
And cost of living increases. The vendors that are marking up drugs and expecting you not to pass that markup on to your clients.
yeah,
That downward pressure on profitability just because the increase in costs, that that's scary, and pet owners feel it, and the
yeah,
veterinarians feel it as well. I think
yeah,
that's something that pet owners maybe don't realize, that
I
the
know.
staff
yeah,
don't
Yeah.
like fee increases, the doctors, the owners don't like increasing fees.
yeah.
We usually think
Yeah,
about
no, it's
ourselves. I'm sorry, Phil, but
no,
usually,
go ahead, Kelly.
if I'm on my pet owner hat and I'm walking through the veterinary door, I'm thinking about me. I'm thinking about my dogs. I'm thinking about the cost to my bill. I'm not thinking about the people's salaries behind the
Yeah,
counter. I'm not thinking about the profit margin for the veterinary hospital as a normal consumer. Now, of course, I'm
Yeah.
in this field, so I think about those things all the time and think about how the practice runs. But the average consumer with their pet walking through the door, it's all about me. And what is it going to cost me today? And what's my story that I have? Right. And
Yeah.
as Phil, as you were saying, we're not selling washing machines. We have
mm,
this human animal bond, and if Fluffy's sick, how do I pay for that? Because this might be the only thing that loves me in life.
yeah. And I think you brought up a really great point right there, Kelly. And you said the human animal bond. And it's something that I, I will say that is like from an emotional point of view. I mean, you guys know I'm very much a feel, on the emotional intelligence scale, as far as a practitioner, but what we are we are doing something as a profession where we lean so strongly into promoting the human animal bond and then increasing cost to where it's just, it's potentially unsustainable. And that's something that I would say I struggle with. I mean, I think there's a good job being done, and we may, I think we had talked about, where hopefully when we have more of us on and doing another guest as far as contextualized care and spectrum of care and what does that look like. But I think it's challenging to the trust and rapport of the profession, overall. And I'm not saying I have the answer, but when we're promoting so strongly the human animal bond, and then we are making it unsustainable as far as costs go, we feel that on the ground. Is that I am in the room, and to your point, what's different is that because it's direct, our staff is our staff is going in and giving an estimate or a treatment plan to an owner right there. And then us being able to, I mean, one of the things that we do at our practice is we very much teach about stress response, and and what that looks like and what that client is going through when we walk in. And they weren't necessarily expecting a $3,500 bill, just throwing a number out there. But also our staff, where we're saying, wow, 7 years ago this was $2,000 what we're doing, and now cost of care and everything is up, and it's a struggle, for us as well. So I think it brings up a number of things. And what I get concerned about too is that one of the biggest benefits that I have as a general practice veterinarian going in is trust and rapport. And if I lose that, it's very challenging for me to be able to practice, because then I'm seen through a different lens. And so, I think I definitely practice differently now, as far as spectrum of care to some degree than I did before, just because, I mean, we were talking about, I had a case, just yesterday, that this was a male dog that was obstructed. And I made a decision to stay after work and do the surgery on the dog, because if I sent that dog to emergency, potentially would have been a $4,000 to $6,000 surgery. And, and I know in our hospital, we were able to do it for half that. And it wasn't keeping the income in the clinic, even though it did do that. But I just didn't want, it's a great client of ours. And I just didn't want to do that. And so I will also say that I don't take all those things on all the time, but it was something that I was able to do in that moment, that I came home and felt really good about it. And I made sure the team understood, what we were doing and how we were benefiting, them, and thanking them for what they, for them staying late. I mean, we compensated them, of course, but still it's time they could have been with their family. But yeah, I know I squirreled a little bit, but that's something that I find interesting in the profession, is that we are promoting. I mean, we have organizations that do this. The Human Animal Bond Institute, which does a great job. I'm not minimizing that, but it's like, what happens when we keep promoting this, and then potentially to our own detriment, is at some point, and it's starting to happen, is at some point we are moving animals away from property legally, and into a pain and suffering. And then what happens to our cost of care if our, malpractice insurance goes from this to, 100 times that? And then we end up having to practice even more, CYA medicine, and somewhat how they have to practice in human medicine, and then efficiency goes down, cost goes up. And and it's harder for us to do the job that we wanted to do ever since we were kids. So I know that was a lot. Sorry.
The story you just shared, though, really does hit on kind of what I was trying to say, just that it's not just about the fee and the costs and the profit. There are motivators there going above and beyond. Yes, saving the client some money, taking care of the pet, what was in the pet's best interest.
Yep.
And part of that motivation was saving the client from something that would have been 3 times as expensive, because you could. Now, we don't always have the flexibility to take care of that. But good medicine requires good business if you're going to do good medicine for very long, and good business requires the good medicine.
Yeah.
But the business side adds a lot of pressure as the costs keep going up. You know,
Yeah.
I'm fortunate. We have the office cats here, and we've got pets at home, and they, I don't have to worry about what the invoice is. Just do what's in the pet's
Yeah.
best interest. But I think that's becoming the exception, not the
Yeah.
norm, as folks do start having to balance what's in the pet's best interest versus what can I afford. And
Yeah.
is pet ownership going to become something that for some people, but not all people?
Yeah.
So I don't think you guys are heavy TikTok users, but I could be wrong, right?
Maybe.
You're,
Yeah.
you're probably not doom scrolling or looking for a whole bunch of things on social media
It's
at
not
all times,
it's
right?
not an app that I own.
Yeah, okay. I kind of was thinking that way, David, but I was doing some presentations lately and writing like we all do in this room and things like that. And people, it's interesting because of the money, because of the considerations, not like an obstruction, right? That's a whole different category, Phil, but just my dog ears stink or their eyes are running or they're scratching a lot, like just lower level considerations, I guess, what I would say. Well, a lot of TikTokers who are influencers are covering these topics and they are not veterinarians. There are veterinarian influencers out there and they're doing a damn good job because they're the rare extrovert and things like that. But like I saw on TikTok, this kid, I swear he wasn't even 20. And he had like 25 million followers. And he was giving out cat care tips on his TikTok. And he had 1 billion views on this TikTok
Wow.
video. 1 billion on cat care tips.
Yeah.
And I thought, well, isn't that interesting? Because that's 1 billion people who are going to go look at a kid less than 20 years old on how to solve some of their cat health problems.
Ouch. Well, TikTok's free.
TikTok's free,
Yeah.
Yeah, no cost there.
no cost
Yeah.
there. But
Yeah.
that is becoming like, we talk about Dr. Google, right? There's Dr. Social Media,
Mm-hmm.
And
Yeah.
AI
Oh, yeah.
now.
AI.
Yeah.
Yeah,
And
and AI is not always
diagnosing is,
accurate.
yeah, we've talked about that. And
Yeah,
AI diagnosing and interpreting. What's the last podcast somebody mentioned it? The client uploaded the full blood panel,
yeah.
Yeah.
and
And it
AI
gives
came back and said
yeah.
X, Y, and Z. I went back to the practice, and yeah, it ended up being that.
Yeah.
But,
Yeah.
but
So
maybe that's a tool. Maybe that helps bring some costs down uh,
Yeah.
within the practice.
Yeah.
I don't know. I don't
And
think there's no silver bullet
yeah.
solution for the costs of pet health care.
And what I'd say is from a professional point of view is like I think one of the most more damaging ways that we can treat that is just blowing it off and just going, they freaking, they're gonna you listen to Dr. Google. And it's like, well, you know, any other profession, tell me you're not Googling like my AC stopped working. Like,
Yeah.
it's just human nature. And
How
so
do I fix my
I'm
washing machine?
yeah,
right.
right. Yeah, right. Right. But in that is like, can we be, and this gets into the trust and rapport, is that, when we talk about just even coaching or counseling or anything like that, there's a process that's called motivational interviewing. And it's if I can sit there and just roll off and like accept those things and then help walk through, and hey, that might be that AI thing. I've gotten those things, and I'm like, yeah, like that's pretty on point. Like, let's go down that road and see what happens. Or if I choose to, take it personally, which is really what is happening, is that there's some emotional response in here that I'm not accepting that. It's going to come out in me being defensive with the client. And then I may lose that client because they're like, oh, see, it's like it's having an open and honest discussion about what their concerns are. That's something AI can't do. and
Right.
that's, again, goes into, if I can do that, and again, come along with that client, meet that client where they're at. That is a it's a big skill, and one of the things that I really love about being a general practitioner, and that I did have to learn, because I wasn't always like that. Oh, my friend said, or my breeder, the old my breeder said this, and it's like, yeah, I can understand where they might have heard that. But the newest evidence shows, from the study or what have you, that this is what the recommendation is, and this is why. And so, like I said, just but if
Right.
your breeder, listen to your breeder instead of your doctor, and what's that do? Like, that's gonna shut down that relationship. Anyway, squirrel again, but can
It's a
we,
part of it,
yeah,
Phil, because
yeah,
if you don't have that relationship, regardless of who your client is, be it a pet
yeah,
owner or David and I working directly with veterinary hospitals and industry as a whole,
hmm,
when you're servicing somebody, right, whoever your demographic is, people want to know that they're heard and they
yeah,
have dollars and they make choices with those dollars.
yeah,
So they're going to spend
right,
them either with you, or in your case, the veterinary hospital down the street, or David and
yeah,
I each have competitors. Well, like you said, if you don't meet people, that's for, that human touch, that human consideration,
hmm,
the animal bond, listening to what's important to me and you and
hmm,
David and our clients, we matter. So
yeah.
you didn't really
That's
squirrel, you
bingo.
talked about mattering and what that means,
That is, oh,
Well,
that is.
and
Go ahead, David. Sorry.
that's the relationship. That's the trusted
Yeah,
advisor.
yeah,
right?
yes,
You're
yeah,
educating me to help and creating a team approach to the pet's healthcare.
yeah,
It's expensive, but with education,
yeah,
choices still have to be made though.
yeah,
When the costs go up and what used to be $1,000 is now 2,500 over 10 years,
yeah,
it, it
yeah,
creates hard choices
yeah,
for the client, and trying to balance the love, the bonds, want to do the best with what can I afford. And that's a real hard place to be.
yeah. um one of the things you just said is, in this environment, there is a huge amount of, there's somewhere, and I was trying to find it the other day, there's not an algorithm, but it's, essentially the difference between, data, information, knowledge, and wisdom, and there's an overabundance of information.
Yeah.
And that is where I, to your point, David, like, where I try to sit in that space is, say, as a trusted advisor, is knowing that there is tons of information that's out there. And if I don't know any better, it's easy for me to misinterpret with my experience, or me trying to simplify things, or Dunning-Kruger, or, whatever that is that I may not be able to walk through that. And so it's again, not, when we have somebody come to us with information, is just saying, like, can I help them walk through hey, you know what? And I've said to clients, like, thank you. Like, I know you are going to spend a significant amount of time, because this is your baby, and you may find something that I'm not even aware of. But if you find something that's not, like, I'll walk you through, what that is. But yeah, like, I don't know everything, and so you may find a study that I'm not familiar with, and, like, please bring it in, and we'll walk through it. But it is that differentiation between information, I think, and I might have it wrong, but data, information, knowledge, and wisdom. And I just love the differentiation between that. I think that's, with experience, I dare say, like, I'm in that wisdom portion right now with veterinary medicine, where I can say, okay, yes, like, if we don't do this test, this is what we might expect if we don't do it, and we try this medication, is in my experience, like, this has been the result. And just letting owners know, like, right off the bat, like, what can we expect if we make that decision. And that's really what my job is now, is more of a coach, and a helper in the shared decision, like you said, a decision needs to be made. And in that shared decision process, can I sit in that role as trusted advisor and not be, and try to keep my biases and emotion, out of it and work together with that
And it
client.
speaks
Yeah.
well that you're able to do that. I think there are a lot of practitioners that when challenged, the wall goes up. I'm the doctor, and it's not a collaboration. It's not let me help you sift
Mm-hmm.
through this. Um, and that can create a barrier, like
Oh
you
yeah.
mentioned.
You're done.
Yeah. And I've done
Everything
it.
we've talked about is
Yeah.
over,
Oh
right?
yeah.
The trust
Yeah.
is gone. The bond between you and the client and the pet owner are gone, depending on who your audience is. As soon as your ego and your defenses go up, the conversation is over, right?
Yeah.
And Phil,
100%.
you're 100% saying, I'm okay not being okay and not having all the answers, right? And admitting
Yeah.
the first time, and you do that a lot in life, like, this is what I know, this is what I don't know, and I'm okay saying that, right?
Mm-hmm.
But what that does is create a space for a conversation to happen between two people.
Yeah. Yeah.
So we're not
Absolutely.
really solving anything about inflation in the vet space, but we're
Yeah.
certainly hitting on a lot of the consequences, if you will, or considerations associated with these costs being high
Yeah.
and increasing.
Yeah.
It's not just the dollars changing hands. It
Yeah.
is, but there's a
Right.
lot more and a lot more impact
But I think
Mm-hmm.
across the team and the clients.
Phil kind of brought up, and David and you and I did, we were kind of suggesting a pathway through the cost, because none of us can change what is out there. It's too big, right? It is the reality what
Yeah.
it is, and it's bigger than the three of us in this room. But what we are suggesting is a navigation through that. And what I'm hearing is connect with the people you're serving, because they matter and they want to matter, and they want to know that their pets, that you understand their pets matter to them. Like,
Yeah.
understand that human connection on all different levels, and be willing to admit when you're not okay or you don't have all the
Yeah.
information, but you're here to help, right? That is a navigation piece through these higher costs. What the outcome is really client specific, I would say. I'm not in the
Yeah.
exam room, but Phil, you treat each person who walks into that door differently based on what they bring in, I'm assuming, correct?
100%. And that's
Yeah.
it's this concept of contextualized care, is that I may have a patient, same presentation, signalment, disease process in two different rooms. And those patients may leave the hospital with two different treatment plans, because
Yeah.
it's, and it's not that I haven't offered those things, but I've come together and say, these are the things we can do. These are the pros and cons of each one. And, I'm here to help you with that decision process, is like, and I'll always, and the thing is what's funny is I'll always say doing nothing is an option, but there are consequences to that. It's like, yes, we can
Right.
not do anything and watch it. And sometimes that might be reasonable. But it's like, if we choose to do nothing, because that's still, I always try to have that as an option to let owners know that it's not necessarily what I would recommend, but it is an option. So yeah.
Well, I guess we'll leave today with saying there are some things we can't change in this world. It's bigger than us, but there's ways we can learn to navigate them.
Yeah.
And that's different for every human being on the navigation. We can give guidelines, but what works for me may not work for David, may not work for Phil, vice versa, right? But we can all learn to navigate and being willing to learn to navigate. Would you guys
Absolutely.
agree? Yeah.
Yeah.
Hmm.
Just do
Yeah.
better.
Just do better. Yeah.
Better.
Well, we'll give you the official Unfiltered Vet discussion wave, and we will thank you for listening to us. And we look forward to sharing time with you on our next episode. I can't even speak, on our next episode. So thank you, and we will wish you adieu.